Hello guys, how are you? I am Hanan Mahmoud Bakir, an emergency nurse. We will now talk about bleeding and how to provide first aid for it. Now, what is blood? Your blood is made up of liquid and salts. The liquid part, called the plasma, is made of water, salts, and protein. Over half of your blood is plasma, but the salt part of your blood contains red blood cells, white blood cells, and platelets. Red blood cells, RBCs, deliver oxygen from your lungs to your tissues. Red blood cells, RBCs, deliver oxygen from your lungs to your tissues and organs. White blood cells fight infection and are part of your immune system. But the platelets help blood to clot when you have a cut or wounds. Now, bone marrow. Bone marrow, the spongy material inside your bones, makes new blood cells. Blood cells constantly die and your body makes new ones. Red blood cells live about 120 days and platelets live about 6 days. Some white blood cells live less than a day, but others live much longer. Now, why do we bleed? The skin forms a protective layer over our bodies. When that layer is damaged, the blood vessels immediately underneath it are torn, allowing blood to leak out. A small cut tears just the small vessels near the skin, and only a tiny amount of blood drips out. But the deep cut might tear large vessels and cause more bleeding. When we bang an arm or a leg, tearing the smaller vessels without damaging our skin, blood collects under the unbroken skin to form a bridge. Because the heart is still pumping blood throughout the body, more blood will continue to leak out until the damage is patched up. To stop the leaking, a torn blood vessels releases chemicals that activate proteins that clump together and form a plug to fill the hole. This seals up the blood vessels and prevents more blood from getting out. Now, the first picture shows a minor bleeding, but the second picture shows a major bleeding. Now, how is a blood clot made? Blood clotting, called coagulation, is a complex chemical process that controls bleeding. This process uses as many as 10 different proteins called blood clotting factors or coagulation factors found in plasma in the blood. Simply stated, this multi-step process changes the blood from a liquid to a solid at the site of an injury. A blood is made up of many different cells, most notably red blood cells, white blood cells, and platelets, as well as the clotting factors. These and other elements flow throughout blood vessels in a straw-like liquid called plasma. Normally, when a blood vessel is injured, for example, from a cut on the skin or an internal injury, blood starts to flow. The first step is controlling blood loss is for the blood vessels to narrow, called vasoconstriction or constriction. So, blood flow lessens. Within seconds, the tiny platelet reach to the sides of the injury and bunch together around the wound. They attract other platelets and help form a plug to close up the break at the sides. When a blood vessel is injured, other elements called tissue factors come into play to help stop bleeding. They start a chemical reaction that causes clotting factors to produce fibrin, a strong strand-like substance that surrounds the platelet plug. Ultimately, the fibrin clots taking on the look of mesh, which keeps the plug firm and stable. Over the next several days to weeks. The clot strengthens and then dissolves as the wound heals. Now, watch the following video. Please pay attention. Now, I will show a video describing a caregiver's providing first aid to a bleeding patient. First, I have to make sure that the scene is safe for me, the patients, and others. Then we carry out the initial assessment for the patients. The initial assessments includes general impressions, level of consciousness, airway, breathing, and circulation. Before delaying with the patients, you must introduce yourself. My name is Hanan. I'm training first aid. Can I help you? What happened? Now ask the patient to help you so that he doesn't lose consciousness. Okay, I need you to hold the pressure. Emergency response protocols for a conscious adult female that is bleeding previously from the leg. Keep holding pressure. Are you doing good? You must ask for help. I need your help. I need your help. I need you to come and grab gloves out of the first aid kits and put them on. I need you to help her lay down and watch her heads. You must make sure the patient's waking up. What's your name? What's your name? You apply your foreheads, and I am looking for another injuries. So let me know if anything hurts. You must make sure the patient's waking up. What's your name? What's your name? You play your forehands. Now we will start introducing interventions. The most important points in these interventions is to treat the shock. To treat the shock by covering the patients to maintain a normal temperature. Okay, I have to apply tourniquet. They are going to feel pressure on your leg to stop bleeding. This is tourniquet. Okay, added another large hair, then hands back on locks. Backs unlock like we can bandage now. I am going to slide this under hands off.